I'm Dr. Pavanka. I want to talk a little bit about heartworm treatment today. So I believe the last time I checked for the year of 2025, which we're almost over, Village Vet had 9 heartworm positive dogs that we found on our heartworm test. With that, typically about 10% of the positive dogs in the area are what we see in the cat population in the area, including indoor-only cats. And I did have one year where I had 2 positive cats. This video is not going to be as specific to cats because there is no recommended treatment for cats. Typically, they either have the worm surgically removed, because cats typically only have 1 worm, and the other treatment would be going ahead and just using the prevention to try to keep everything at bay if you can. The problem is when the worm starts to die, a lot of times we'll have reactions to that, and we can have the cats pass away with that. So it's very sad for our cats. I've heard ferrets are very similar to that because they are smaller. With that, they typically only have 1 worm, and heartworms do have male and female worms. So our test for the female worm uterus, if I remember correctly, and cats could only have a male worm, meaning that they could not show positive on that test and be a false negative. So there is the American Heartworm Society that has a lot of information on heartworm, but just going over it, I kind of have a brief overview that you can get from the American Heartworm Society when you go ahead and you say, hey, you know what, I have this dog that's coming in, they weigh this much, what's the recommended timeline, what's the recommended dosing and everything for them. So starting off, you get your dog's diagnosis as far as they have heartworm. Like I said, cats, there's no specific treatment for that. We don't have melarcimine that works for them, which is the injection we use for dogs. So we typically don't do that for cats. So with that, as soon as we hear that they have heartworm, we want to restrict their exercise because heartworms are a blood-borne worm. So the more that we work out, the more that we move, the more damage we typically see. So there is a connection between activity level and prognosis. And then typically if they're symptomatic, we'll go ahead and start them on a steroid. I have to say I usually start them on a steroid anyway, because when we start killing those worms with our treatment, we can see allergic reactions and even anaphylaxis, which is a severe allergic reaction that can end up with death. And typically we'll do a month's course of that steroid with a month's course of an antibiotic called doxycycline that helps kill a kind of a beneficial little bacteria that lives on the worm and helps the worm survive, called Wolbachia. With this, we typically do want to either retest to see if they're negative on a different test, or we look for the microfilaria, which are those the worms that we can see in the blood. And if we see the microfilaria positive, or we get that confirmation back, that's when we go ahead, we start our steroids, we start our antibiotic. After we finish the antibiotic, we typically will have them come back a month after that for their first treatment of the medication. But in the meantime, we do want to get them started on prevention. Now, we do start them on heartworm prevention despite being positive, and this is something that always comes up when we talk about our heartworm tests, because if they are heartworm positive, we do want to be very careful with our prevention, because if the worms die too fast, just like with those cats, we can actually cause that anaphylactic reaction and cause some big issues for our dogs too. So with that, we typically will either put them on an antihistamine, or that's kind of why I use the steroid, so that we can go ahead and make sure that they're going to be okay with that. I haven't seen too many dogs have really bad reactions in clinic for that, because at Village Vet, we do have them have their prevention the first time in clinic so we can monitor them. But I have had some dogs turn blue because they weren't getting enough oxygen, and they did get a little bit of oxygen therapy and more intervention that I normally see with those asymptomatic dogs that are at an earlier stage of heartworm disease. So after that 1 month, you finished the doxycycline, that antibiotic, a month ago, they'll come in, and there's 2 different protocols. It used to be that they just came in for 2 different treatments. There would be one day, and then the next day they would come back and they would get the second treatment. But they've actually found that ideally, gold standard, they should come in one time, and then about a month later they come in for those 2 doses 24 hours apart. So with this, a lot of times I do like to use pain medications. I do give the medications like gabapentin and trazodone to keep them nice and calm and quiet in recovery, because a lot of times these guys, when they have the heartworm and they are more debilitated with it, they don't want to be as active. But again, we don't want them running any marathons with this and causing a poor prognosis. So we do try to keep them almost under a cage restriction, where they only go out to go to the bathroom and then come back in. They don't really go on any walks or do any sport activities. So we do give that intramuscular injection, meaning the injection is usually a large volume that stings, and it goes in the muscle so that they have that heartworm treatment. It kills the heartworms, and that steroid helps with the reaction that we get from those worms dying and breaking down in their bodies. So you have that first treatment, and then a month later, 30 days later, you have the second, and then the day after that, the third treatment. Now, after that third treatment, we will go ahead and each time they come in, they start another steroid course over again. In that third treatment, they should be good for a month, and then when they come back a month later, we check for microfilaria, those little worms in the blood. If we find that there are worms in the blood, we kind of don't do too much. We go ahead and make sure that they're continuing with their monthly prevention. And then we have them come back in 9 months to retest that heartworm test, and also, again, look for the microfilaria. If they're negative, that's wonderful. They don't have to be under exercise restrictions anymore. They can go back to their normal life. We just ask that they stay on their monthly prevention year-round. If they're positive, then we do recommend that they undergo another heartworm treatment, and they have to keep that cage rest, the restrictions on their exercise, and keep up the medications. With these medications, we do typically go for Heartgard because it kills a little bit more slowly, from my understanding, than the Interceptor does. But we'll go ahead and do a approved prevention for heartworm, and we will also have them go on a EPA approved prevention that helps with, that's more of a topical usually, to help repel the mosquitoes. Because the last thing we want is for a mosquito to feed from the positive dog and potentially spread the heartworm that way. They can't really spread it face-to-face contact or anything like that, but we do get it from mosquitoes. So just takes one mosquito to get in the house to give your cat a heartworm, so they're heartworm positive. And the same thing goes for our dogs. It just takes one mosquito. So it is a pretty severe disease. And a lot of times we do notice exercise intolerance, so they just don't have the energy to do anything anymore. And sometimes they'll have a little bit of a cough, because when they get really bad, they'll get what's called cable syndrome, where the heart actually balloons out and we start to see those worms in the lungs even. So that's kind of the gist with heartworm. I don't think I have anything else on my notes that I wanted to go over. There are some side effects with those medications. The melarsoline injection usually makes them kind of sore. I've seen some dogs that have dermal reactions as far as a little bit of dermatitis with it. We do typically shave. Not every clinic does, but I know I like to, because I like to scrub it, make sure it's really clean, because I'm putting something deep into the muscle and I want to make sure everything's as clean as possible. And then with our steroids, that's where we see the biggest side effects, because our dogs are kind of sensitive to steroids. So we usually will see panting, we'll see increased thirst, increased hunger. Because they're drinking more, a lot of times they pee more, so it is really important to get them out. I've had a couple dogs that they were just so tired from the sedatives and really needed to go because of the pred that they actually just urinated and laid in it. It's not a fun treatment by any means, and I do recommend monthly prevention for that reason, especially for our cats, because this is not a treatment that works for our cats. So do let me know if you have any questions. But I figured since we're looking at 9 this year so far, I wanted to go ahead and share what the heartworm treatment looks like, so that you have a better idea of what we're talking about when we say prevention, or if unfortunately your pet does have heartworms, you kind of have another mode of hearing about what we typically do, so you have more information